I'm Dr. Nancy Duncan. And one of the most common questions I hear is, well, what causes hearing loss? And the truth is, most people who ask this question are quite surprised to learn just how many different factors there are that can affect your ears and your hearing. And the good news is, once you understand the causes, you can often do something about them and perhaps lower your risks of hearing loss, as well as the risks that have been detected going with untreated hearing loss. First, most people in their 50s, 60s, and beyond notice changes that creep up slowly. This is called presbycusis, which is simply age related hearing loss. So you want to think of the hair cells in your inner ear like piano keys. Over time, some of them can wear out and stop responding. And that doesn't mean you stop hearing altogether, but you may notice that voices sound muffled, dull, or less sharp, especially women or children's voices, and especially in those more challenging listening environments, like a restaurant or a group setting. And it may be fair to say that you may have noticed yourself asking people to repeat themselves more often than in the past. Many people who've experienced this situation tell me they don't even realize how much they've been missing until they see their test results and we've described them to them and when they hear a different way. So, second, the truth is one of the leading causes of hearing loss today is simply noise exposure. At one time, most of the people that I saw, they had worked in noisy factories or around noisy farm or construction equipment. But these days, we're seeing things like loud music, listening to your AirPods too loudly, or wearing loud gaming headsets. So think about the situations you may have found yourself in over your lifetime. If you're like me, you've gone to loud clubs when you were younger, loud concerts, you've worn earbuds turned up too loudly, used power tools, or simply worked in a noisy environment. And did you know even mowing the lawn without hearing protection can take a toll on your ears over the years? So the good news is this type of loss is absolutely preventable if you protect your ears. If you choose not to protect your ears, what will happen next is you may start noticing difficulty following conversations, especially in restaurants, or you might find the TV creeping louder and louder. And if you find that you've started experiencing these slight and subtle changes, imagine how different things would feel if you didn't have to work so hard just to keep up in noisy places, or if your friends or family didn't have to repeat themselves or turn the TV up for you. Also, it might surprise you to know that hearing loss isn't always permanent. Sometimes it's as simple as a buildup of earwax. Other times, infection, certain medications, or even head injuries can play a role. And the truth is, even conditions like diabetes and heart disease can affect your hearing because healthy hearing depends on good blood flow to the inner ear. So, the first step, if you're feeling something's just off, is to get your hearing evaluated to make sure it's not something as simple as getting your ears cleaned or taking medication to treat an infection. So, how would you feel if you knew that untreated hearing loss has started to affect not just your hearing, but possibly your memory, your physical stability, your confidence, and your relationships? Many people don't realize that untreated hearing loss has been linked to social isolation, cognitive decline, and an increased risk of falling and an even greater risk of dementia, especially when communication becomes more challenging and exhausting. These risks increase dramatically, and treatment can decrease them dramatically. And the good news is the earlier you address it, the more options you'll have, and the easier it is to stay sharp, engaged, and connected. And you can lower your risk of falling and experiencing cognitive decline. These things can be lowered dramatically with treatment. So, what causes hearing loss? Age, noise exposure, medical conditions, and sometimes a combination of all of the above. So many people feel worried about, well, what comes next? The good news is it starts with a simple hearing test. What will happen is during the test, we'll go through a series of evaluations. We'll go over the results together and explain what's going on and talk about treatment options that fit you and your lifestyle. So, would you be open minded on taking that first step? Just imagine how much better life could feel when conversations are effortless again. If this sounds like you, reach out and we'll take good care of you. I'm Dr. Nancy Duncan, and I look forward to helping you reconnect to the people and moments that matter most to you. I hope you've enjoyed this episode. Give it a thumbs up if you did and click that subscribe button so you don't miss the next one.